S. Subjective. Patient history, symptoms, and complaints from parents or older children. Chief complaint and symptom onset, feeding and sleeping patterns, developmental milestones, behavioral concerns. O. Objective. Clinical findings and measurements. Vital signs like temperature, heart rate, and respiration, growth charts and weight, physical exam findings, lab results. A. Assessment, nurses or physicians' clinical judgment. Clear diagnosis or differential diagnosis, age appropriate conditions, developmental considerations, P, plan, treatment, and follow up recommendations, medications, dosage, and instructions, care instructions and nutrition advice, follow up plans and referrals. Define assessment scope. Evaluate SOAP notes for clarity, completeness, and accuracy. Ensure compliance with pediatric documentation guidelines like HIPAA and AAP standards. Identify missing or inconsistent information in patient records. Select eAuditor checklist. Review if each SOAP component is properly documented. Assess legibility and medical accuracy. Verify adherence to facility protocols. Gather relevant data. Access pediatric medical records, previous SOAP notes, and facility documentation policies. Subjective assessment, verify documentation of patient history and chief complaint, symptom onset and progression, feeding and sleeping patterns, developmental milestones, behavioral concerns reported by parents or guardians. Objective assessment, confirm documentation of vital signs like temperature, heart rate, and respiration, growth charts and weight measurements, physical examination findings, laboratory and diagnostic test results. Detailed observations such as skin color, hydration, and respiratory sounds. Assessment evaluation. Review if assessment logically follows subjective and objective findings. Check for clear diagnosis or differential diagnosis. Ensure age-appropriate conditions are considered, like developmental delays and common pediatric illnesses. Plan evaluation. Verify if prescribed medications, dosage, and administration instructions are included. Ensure care instructions, hydration and nutrition advice, and follow-up plans are clear. Assess whether necessary referrals, such as to pediatric specialists or speech therapy, are documented when needed. Automated report generation. Generate SOAP note assessment reports instantly through eAuditor, including photos if applicable, compliance ratings, and evaluator comments. Documentation gap identification. Highlight missing subjective data, incomplete assessments, or unclear treatment plans. Recommend training sessions for staff on improving pediatric SOAP documentation. Compliance analysis. Evaluate adherence to pediatric documentation standards, regulatory requirements, and facility protocols to ensure legal and clinical compliance. Notify nurses, physicians, or administrators about inconsistencies. Schedule regular follow-up assessments to maintain compliance. Update documentation protocols based on recurring issues. Provide education on effective pediatric SOAP note documentation. Regular documentation audits. Perform monthly or quarterly assessments to track improvements and revise SOAP note templates to meet evolving pediatric care needs. Staff education. Provide ongoing training on pediatric specific documentation requirements and best practices for comprehensive SOAP notes. Performance tracking. Use eAuditor to monitor documentation quality metrics and identify trends in compliance over time. Process refinement. Continuously update assessment criteria and documentation standards based on regulatory changes and clinical best practices.